Hi, my name is Dr. Erica Steele, and this is our Wellness Wednesday post. So I think I want to discuss today the importance of medical freedom. So a lot of times people get a negative connotation to medical freedom, especially at this time where vaccination is such, a polarizing topic that has sharp opinions on both sides. And so whatever your personal view is on vaccination, that's totally fine. We all have to do what is best for us as well as our family, but also to what we trust in our relationship with our medical or healthcare provider. I am not pro-vax, I'm not anti-vax. I am actually pro-medical freedom. And what that means is that I choose to look objectively at all the different factors that I see with a patient. That can include their health history, that can include their laboratory, that can include their genetic information if I have that on file. And so I like to look at all of the known data that I have, as well as answer any questions that the patient may have, and then look objectively, because that's our role as healthcare providers. It's not to coerce anybody to do anything one way or the other, but it's much rather we look objectively and we are civil servants, if you will. Our role is to look at all of the information held at the time and then be able to present all of the different options to the patient so the patient can powerfully make a decision for them as well as their family. And so we have always been an advocate for medical freedom. We do so in support in the General Assembly in Virginia, and we also will do so on a federal level if necessary. And so we wanted to make sure that everybody understands the importance of the sanctity of the relationship between the doctor and the patient. I truly believe that there is no place for the government to be involved in the relationship between the doctor and the patient. The government does not have the medical history of the patient. The government doesn't have the fears, the doubts, the worries, the thoughts, the ideas, any of the information that is from the patient. So we really want to remove not only the government, but also the health insurance companies from the middle of the doctor-patient relationship. And so that's why in our practice, we don't accept insurance, because we don't want the insurance company then to come in and be mandating what we do or don't do with the patient. We want to be able to provide that freedom to be able to educate our patients and be able to serve our patients in the way that we best see fit as holistic healthcare providers. And that's looking at all aspects of the patient, both mental, emotional, as well as physical, to really help guide them and help them to live a healthier life. So we hope that everybody understands the importance of medical freedom, because we want to make sure that everybody is able to make a powerful decision and a choice for them and their family, even if that means that they choose to do, an inoculation, or they choose to do a procedure that even their family doesn't agree with. A lot of times, even in end-of-life care, I'm working with patients, and sometimes their views don't match up with the views of their family. And so in those cases, my job is to fully advocate for that patient and communicate that to the family so that the patient really helps their wills and their wishes and their ideas to really be able to be respected. So hopefully that was helpful for you. Thank you guys so much for tuning in. I'm going to sign off this Wellness Wednesday and go vote, because today is really important for us in our medical freedom stance in the state of Virginia. Thank you.